Individual and Group Grief Counseling by Alexandra Golfus. Task and Mediators of Mourning Explained. Task Model of Mourning. Mourning, the adaptation to loss, involves 4 basic tasks, including 1. To accept the reality of the loss, 2. To process the pain of grief, 3. To adjust to a world without the deceased, and 4. To find a way to remember the deceased while embarking on the rest of one's journey through life. Mediators of mourning. Mediators of mourning help to account for the range of grief reactions between individuals. Mediators of grief include 1. Kinship. Who's died? Dead person's relationship to the survivor. 2. The nature of the attachment. Survivor's attachment to the deceased. 3. How the person died. Natural, accidental, suicide, homicidal. 4. Historical antecedents. How previous losses were grieved, mental health history, and so on. Complicated mourning. Complicated mourning is a term used to describe when there is something that is impeding the mourning process and not allowing an individual to move forward towards a good adaptation to their loss. Note: individuals experiencing complicated mourning may be better suited for individual therapy rather than group therapy. The mourning task and mourning mediators can give both therapists and patients a clue as to what is going on and provide a framework for effective interventions. Although complicated grief is not listed as a clinical disorder in the DSM-5, the DSM-5 does provide diagnostic standards for chronic complicated bereavement disorder. So let's go on to talk about what is chronic complicated bereavement disorder. Well, chronic complicated bereavement disorder entails long-lasting symptoms that do not get better with time with the severity of symptoms that interfere with day-to-day functioning, including deep emotional suffering, empty and gloomy sensations, desire to meet the deceased again, obsession with the deceased, having troubles remembering nice moments with the deceased, avoiding any references to the deceased, a weaker feeling of self, separation and seclusion from surviving relatives, and an unwillingness to pursue personal goals or interests. Grief and counseling considerations. Grief is a personal journey, and the most effective counseling approach depends on the individual. Both individual and group therapy offer unique benefits and drawbacks. When considering whether individual or group counseling is more suitable for a bereaved person, it is essential to weigh the risks and benefits of each approach. The purpose of this PowerPoint is to contrast and compare group grief counseling versus individual counseling and identify when and why group counseling would be beneficial. Individual grief counseling, benefits and risks. Benefits: confidentiality. Individual grief counseling provides a safe and confidential space for exploring unique emotions and experiences. Individual grief counseling also helps to create flexibility, meaning that the therapist can tailor the approach to an individual's needs and pace of healing. Additionally, there's personal benefits to individual grief counseling, meaning that an individual grief counseling is ideal for addressing complex/complicated grief or unresolved issues from the past. But there are still some risks to individual grief counseling. One risk would be the cost. It can be a barrier for some individuals. Another risk is isolation. Some individuals may feel more isolated when dealing with grief, and they want to connect with others to understand their loss. There's also a limited perspective. Without exposure to others' experiences, the bereaved individual may miss out on valuable insights and validations to help normalize their grief process. There's also a potential for dependency for a grieving individual to become overly dependent on the support provided by a counselor. When to recommend individual grief counseling. When the bereaved person struggles with privacy concerns and needs a confidential space to process their grief. when their grief is complex, involving unresolved issues or past traumas, when they have difficulty expressing themselves in a group setting. Group grief counseling benefits and risk. Benefits: validation. Offers a sense of belonging and validation through shared experiences. Social support. Learning from and supporting others can promote healing. Cost. Group counseling is often more affordable than individual therapy. Risk. Triggers. Sharing and hearing other stories of loss may trigger intense emotions. Lack of I can't say the word right now. Individualized attention. There we go. So basically, group dynamics may not always be conducive to an individual's particular needs. Another risk is the group dynamics. Differences among members could kind of disrupt the therapeutic process, if I could speak today. When to recommend group grief counseling. Group grief counseling can be a valuable resource for individuals who feel isolated in their grief and desire connection with others who understand, desire validation and empathy from others who have experienced similar losses, are seeking a sense of community and shared experiences to cope with their grief, could benefit from hearing different perspectives on grief and coping strategies, can comfortably share their experiences and emotions in a group setting, want to exchange coping strategies and resources, are experiencing uncomplicated grief, defined as a natural response to loss with a healthy progression through the task of mourning. The role of support groups in grief counseling, Part 1. Grief counseling groups offer people the opportunity to release powerful emotions they may otherwise keep to themselves. Additionally, the grieving process is normalized via support groups. Some of the roles of support groups in grief counseling include fostering hope, helping with feelings of isolation, providing different viewpoints, helping members gain a sense of purpose, and helping to create a sense of belonging. The roles of support groups in grief counseling, Part 2. Support groups can serve as a valuable complement to individual therapy, offering validation and empathy from peers who share similar experiences, normalizing the range of emotions associated with grief, practical coping skills and resources for navigating daily life, and a sense of community and belonging during a difficult time. The role of support groups in grief counseling, Part 3. Support grief groups provide a safe and supportive environment for individuals to express their emotions, share experiences, and receive empathy and validation. Support grief groups offer a sense of belonging and normalcy by demonstrating that grief is a universal experience. Support grief groups help to facilitate the exchange of coping strategies, resources, and information among participants. Support grief groups empower individuals to navigate their grief journey more effectively through mutual support and shared understanding. But remember, it is important to note that support groups are not a replacement for professional therapy. A therapist can provide individual guidance and support tailored to each person's unique needs. The decision to participate in individual or group therapy is ultimately a personal one. Encourage your clients to explore both options and choose the approach that feels most comfortable and supportive for them. Lastly, remember, clients can participate in individual and group therapy if they desire. So it's not a pick one or pick the other. You can definitely do two, and it may even be beneficial for most. These are all of our lovely references for the slide. Some more references if you want to dig into the information we covered today. And lastly, thank you.